Okay, so if you want to see if someone has tetanus, you want to see if they have the tetanus toxoid in their serum. So you basically take some of their serum and you mix it with monoclonal antibodies against that toxoid. And if they do have tetanus, the antibodies will bind with the toxin and they'll form this zone of equivalence, which is basically just this cloudy section in the tube. Okay. Now, if they don't have this toxin, the antibodies will just stay on the bottom. It'll just look like a clear solution. If you do have the toxin, again, it'll bind with the antibodies and make this cloudy precipitate in the middle of the tube. And that tells you that this person had tetanus toxin in their serum. Okay, so this is a visual test to see if someone has a certain type of disease. Let's skip over that. Agglutination reactions. That's what's used mostly on the big analyzers that are in clinical laboratories. So again, when you give a blood sample and they're trying to determine what type of disease you might have, they usually run agglutination reactions on these automated instruments. And basically what it is you take antibodies directed against a certain bacteria or virus, mix it with this patient's serum, and if they have that bacteria or virus, the antibodies will form this lattice structure and bind together with all the bacteria or virus and cause these precipitates to occur. It's called agglutination. So I'm not going to go over both examples here, but basically what happens is the more of the bacteria or virus you have in your serum, you get more of these precipitates forming in solution, and then basically what happens is you shine a light through there, and the more precipitation you have, the light gets scattered, and you measure how much light scatter there is, and the more light scatter you measure, the more of the bacteria was in the culture. Antibody titer testing, it's basically a way to test of how much antibody someone has in their serum against a specific antigen. So you basically take somebody's serum that has the antibody in it, and you dilute it to different dilutions, 1 to 20, 1 to 40, 1 to 80, so on and so forth, and you mix it with a particular antigen. And then basically when you have the well that looks like this, it means there's an agglutination reaction, which means there is enough antibody to form a reaction against the antigen. Eventually, it'll be so dilute, you'll dilute out all the antibody and you will get a negative response. So basically looking at where it goes from positive to negative tells you how much antibody was in the patient's serum. Hemagglutination is a way to tell if a patient has a viral infection. So there's not all viruses, but a lot of viruses will agglutinate red blood cells. So they'll cause red blood cells to kind of clump together. So what you would do is you take some of the patient's serum without the red blood cells, just the serum that would have virus in it, and you mix it with red blood cells. And if there is virus there, it'll cause the red blood cells to clump, and you can measure that. The other way you can test for virus is you can test to see if a person has antibodies against the virus. Rather than trying to test for the virus itself, you can test to see if the patient has antibodies against the virus. And what you can do is you can mix red blood cells with the virus. And if there's no antibodies in the patient's serum, the virus will bind to the red blood cells and cause agglutination. If the patient has antibodies against the virus, the antibody will bind the virus, and it won't allow the virus to bind the red blood cells, and you won't get any agglutination. Okay. Something called a neutralization reaction. It's a way to test if a patient has a toxin in their serum. So there's certain types of cells that you can mix with patient serum, and if they have a toxin, the cell will be damaged, and you can measure the cell damage in various ways. If the patient has antibodies against the toxin, you can do that too. You can take the toxin and mix it with the cell and mix some of the patient's serum there. If the patient has antibodies against the toxin, it will bind to the toxin, and the toxin won't be able to bind to the cell, and you won't have any cell damage. Complement fixation test. Again, it's a way to test if there's a certain type of antigen in the serum. So you take antigen and complement, and you want to test, in this case, you want to test to see if the patient has antibodies against a certain type of bacteria. So you take the bacteria and you take complement and you mix it with the patient's serum. Okay, if the patient has antibody, you'll get complement fixation, because again, complement requires antibody binding in order to be activated. If there's no antibody in the patient's serum, you'll get no complement fixation. And the way you measure that is if there's complement fixation, you add sheep red blood cells, and complement fixation basically protects the sheep red blood cells and doesn't allow the sheep red blood cell to be degraded. However, if there was no complement fixation, the red blood cell will get degraded by the antibody, and it'll basically turn the tube red. So this is how you tell to see if another way to tell if a patient has antibodies against the bacteria. Let's skip over that and that. ELISA stands for enzyme-linked immunosorbent assay. The way it works is typically you have a 96 well plate, so a very small plate with these small individual 96 wells. You have an antibody against the antigen that you're trying to detect. It's bound irreversibly to the bottom of the well. You then put the patient sample in. If they have bacteria, it'll bind to the antibody. Then you put a second antibody on top of that. Again, if there's bacteria there, that second antibody can then give you a readout to give you a positive result. If there was never any bacteria there, this second antibody would have nothing to bind to, and it would just wash away, and you would get no response. Serological tests, again, it's a way to see if you have certain types of antigens or antibodies in your serum or other bodily fluids. The one that most people are familiar with, whether or not they know it's a serological test, is the pregnancy test. Basically, it's just a very small ELISA. So it has antibodies. This little window has antibodies fixed to it. You urinate on it. If you have the hormone that indicates you're pregnant, it basically gets captured by the antibody. And then there's a second antibody that's mixed in here that gives you a colorimetric readout if your antigen did bind here. And basically, so that line that you see, if, I don't know, positive 1 line or 2 lines, whatever it may be, is based on the colorimetric readout you get from the secondary antibody. So again, we've gone over basically 2 different types of tests. There's direct tests, so you can test directly for the antigen. If you think a patient might have an infection, bacterial infection, viral infection, you can test directly to see if the bacteria or the virus is in their serum or urine or whatever other secretion. Or there's an indirect test where you can test to see if the patient has antibodies against the microbe. Rather than testing for the microbe itself, you can test to see if the patient has antibodies. If the patient has active antibodies, that suggests that they have an active infection. Okay. So that's the difference between a direct test and an indirect test. Then finally, it's just a couple of definitions. I'm not going to go over all of them. They were basically mentioned in the previous slides, and so if you have any questions about certain vocab that's in there, you can go back to this slide, and it'll give you some answers. Okay? Any questions? I'll be collecting your reports in lab, so make sure to bring them to lab. I will be handing out